Hello everyone, and thank you for joining us today. The program today is entitled Medical Errors, a very serious topic. We'd like to thank Cablevision for the opportunity that they've given us to present our viewpoints to the public. We would also like to thank Merrill for inviting us onto the show. My name is Anthony Colantonio. I am a general surgeon practicing in Nassau County. Today we're going to be speaking about medical errors. I'd like to thank our guest today, Stephen. We will hear his story, both good and sad. I'd also like to thank the listening audience that is here today. And finally, would like to thank all of the audience members that are listening to us today outside of the studio. We'll hope you will be informed regarding the facts that we are about to discuss. Hundreds of millions of patients are treated every year in all the hospitals throughout the United States. Those hundreds of millions of patients are cared for adequately, lives are saved, pain is relieved, smiles are brought to many faces, and that is the good side of the story, the excellent side of the story. However, there is a significant number of patients that are killed as a result of medical errors. That number in some reports reaches 1 million. In other words, it is possible that there are 1 million patients dying every year secondary to medical errors. To put that into perspective, it's equivalent to 3 jumbo airline jets crashing and all of the passengers on those planes dying on a daily basis. If those reports are accurate, medical errors are the #1 cause of death in the United States, ahead of heart disease, which kills approximately 750,000 patients a year, and ahead of cancer-related deaths, which kill just over 500,000 patients a year. And those are just the deaths related to medical errors. There are millions of patients that are maimed and injured every year because of medical errors. And now again, there are hundreds of millions of patients that are cared for properly and adequately. And our job here today is going to try and resolve the medical error problem in the United States today. And again, I want to thank Stephen, who is our guest here today. We will review his medical history. Stephen, thank you very much for coming here today. And Stephen, you've availed yourself of the healthcare industry multiple times in your life. Tell us the first significant time that you approached the healthcare industry and the doctors.
Well, the first time I was diagnosed with Hodgkin's disease, it's about 20 years ago.
Tell us a little bit about Hodgkin's disease.
It's a form of cancer. If you catch it early enough, your cure rate is pretty good.
And how long ago was that, Stephen?
About 20 years ago. Fortunately, I had good doctors who were caring and were able to diagnose the problem right away. And 20 years later, I'm fine and it's still in remission.
So, Stephen, would it be fair to say that if it were not for the doctors and nurses that cared for you 20 years ago, you would not be here today?
Oh, absolutely. Absolutely. If it wasn't, no question about it.
And at that point, you were very satisfied with the care?
Oh, absolutely.
However, Stephen, sadly, I think there was a time, a future time, where you became a victim of a medical error. And tell us a little bit about that.
Well, I was having trouble with my back, and doctors recommended that I probably go for epidural steroids, that I had degenerative discs.
Right, those are injections.
Correct.
That are placed right into the back.
Correct.
Yes.
So I went to Dr. Harvey Finkelstein, and he gave me these epidural steroids. Actually, I went to him twice.
And did they work?
Yes, it did help.
The pain was relieved?
The pain was relieved for a short period of time.
Yes.
And, I tried to go back to my normal way of life, and, it just didn't last that long.
And then that's the second time that you were pleased. The first time was the Hodgkin's, all went well, your life was saved.
Yes.
The second situation where you were in severe pain, the injections provided by Dr. Finkelstein removed that pain.
Absolutely.
then subsequent to those visits, I believe you had another involvement with the healthcare system, and what was that?
Yes. Then I had gone back to him a second time, and they performed epidural steroids again, which was Dr. Harvey Finkelstein. Only this time it was done, instead of in his office, they did it at Central General Hospital in Plainview.
And at that time, was your pain relieved?
Not quite as much as the first time, but yeah, it was relieved.
Okay, and I believe you went on to have surgery.
Yes, that really helped. I had actually 3 laminectomies done.
And what is a laminectomy?
Actually, what they do is they clean around the disc. They relieve the nerves from touching the bones or something like that.
Right. It's my understanding that there's some bone that's impinging on a nerve that's causing severe pain.
Correct.
And the surgeons performed an operation to relieve that pain.
Yes.
And at that time, you were very happy with the surgical care.
Yes, hospital care, the nurses, the doctors, everybody was, yeah, they treat you good. They treat you well.
And very happy with the nursing care.
Yes. You know, I think they're a little bit understaffed. You know, the nurses have, you know, a lot of patients to see, and you could see that they're doing a lot of other work where, you know, they can't really devote as much time to the patients as they would probably like to. But, you know, they're being tied down by a lot of red tape, a lot of forms that they have to fill out. It's tough for them. I really think everybody is understaffed, the doctor staff, the nurses staff.
Wow, that's an interesting point you bring out, Stephen, because I also believe that the nurses are understaffed. I believe the nurses are overworked.
Definitely.
I don't think they're paid enough.
No question.
For the job that they do and the value of the job. They certainly deserve to be paid more.
No question.
But I too believe that it's the distractions that they have to incur that prevents them from doing the excellent job that they need to do.
The care that they have to give the patients, there just isn't enough time.
And there are times where those distractions lead to medical errors, medication administration errors, things along those lines.
I would think so. Of course, I'm not a doctor. I'm not there behind the scenes to look at these things, but it just makes sense.
And that may be the first way to resolve the problem with medical errors. Do you think there would be fewer medical errors if doctors had more time to spend with patients and nurses had more time to spend with patients?
No question about it. No question about it.
So there we have our first solution, that doctors are afforded more time to spend with patients, and nurses are afforded more time to spend with patients. But Stephen, getting back to your medical history, there did come a day where you received notice that there may have been a problem in the past with your medical care.
Yes.
Please, tell us about that.
I received a letter from New York State telling me that I had been a patient of Dr. Finkelstein's. I received the letter this past December 14th of 2007, which is like 3 months ago. I had seen him back in around 2000, 2001. There's a statute of limitations that states you can't do anything about it, so to speak, for 2.5 years. And I now found out that the state had been investigating him for close to 4 to 5 years.
And about what?
About evidently him using a multi-dose syringe, doses of, what the heck do they call it, medicine.
Yes.
And that he was using syringes more than once. He was changing the needle, but he was using these syringes more than once. If they knew this, why didn't they notify me 3, 4 years ago and make me aware of this, instead of me waiting 5 years, going to my doctor, getting tested, and finding out that I have hepatitis C?
And that's an excellent point, and that's your second excellent point. Do you believe that if the public was better informed, that there may be a reduction in medical errors?
I would think so. I mean, it makes perfect sense to me that it should be, you know, that there should be some type of somebody looking over this to